An electrical injury occurs when an electric current passes through the body, disrupting internal organ function and potentially causing tissue burns. While skin burns are common, many serious internal injuries may not be visible. Doctors assess for abnormal heart rhythms, fractures, and spinal cord damage to determine the full extent of harm. Electricity affects the body by generating intense heat, which destroys tissues like skin and internal organs. Additionally, an electrical shock can short-circuit the body's natural electrical systems. This causes nerves to transmit impulses erratically, leading to violent muscle contractions, cardiac arrest, seizures, or loss of consciousness and other brain abnormalities. The severity of an electrical injury depends on several critical factors. These include the intensity of the current, whether it is direct or alternating, the specific pathway the current takes through the body, the duration of exposure, and the body's electrical resistance. Understanding these variables helps medical professionals predict and treat damage. Alternating current, or AC, found in household outlets is generally more dangerous than direct current from batteries. AC causes continuous muscle contractions, often preventing a person from releasing the source, which prolongs exposure. Even small amounts of AC can cause chest muscles to contract, impairing breathing and leading to deadly arrhythmias. The current's pathway is critical to the outcome. A current passing through the heart, such as from arm to arm, is significantly more dangerous than one traveling from a leg to the ground. Furthermore, the duration of exposure is a key determinant. Longer contact with the current consistently results in worse injuries. Skin provides the body's primary electrical resistance. While thick, calloused skin offers greater protection, wet or broken skin significantly reduces this resistance, leading to extensive internal damage. If skin resistance is high, damage is often localized to burns. However, low resistance allows the current to devastate internal organs and systems. Symptoms vary widely, ranging from muscle pain and mild contractions to falls that cause joint dislocations and fractures. Severe shocks can trigger powerful muscle contractions sufficient to throw a person to the ground. These blunt injuries require immediate medical evaluation, even if the electrical burn itself appears to be relatively minor. High-voltage injuries can cause massive internal burns and compartment syndrome, where compressed arteries cut off blood supply. Muscle damage may release myoglobin, a condition called rhabdomyolysis, which can lead to kidney failure. Neurological symptoms include seizures, memory problems, personality changes, chronic pain, and even the development of cataracts later on. Diagnosis involves a thorough evaluation of visible injuries and an electrocardiogram to monitor heart activity. Doctors may use blood tests or imaging like CT and MRI scans for unconscious patients. Hospital admission is necessary for those with abnormal heart rhythms, pregnancy, severe internal injuries, or a history of heart problems. Treatment begins by safely separating the person from the current source by shutting off the power. Rescuers must never touch the victim until the current is off to avoid injury. Once safe, check for breathing and a pulse, starting CPR immediately if needed, and call for emergency medical assistance. Medical interventions include administering intravenous fluids for rhabdomyolysis, tetanus shots, and pain relief. Skin burns are treated with specialized creams and sterile dressings. Children who suffer mouth or lip burns from electrical cords require specialized dental or surgical evaluation, as these injuries can cause long-term growth and bleeding issues. Prevention is paramount and starts with education. Ensure all electrical devices are properly designed, installed, and maintained by trained professionals. All devices should be properly grounded using three-pronged outlets. Never cut off the third prong of a power cord, as this safety feature is essential for preventing accidental shocks. In areas where water is present, such as kitchens and bathrooms, use circuit breakers that trip with low current leakage. These devices are designed to interrupt the circuit instantly if a leak is detected, providing a critical layer of protection against electrocution in high-risk, wet environments within the home. To prevent arcing injuries from high-voltage power lines, never use poles or ladders near them. Electricity can jump through the air to a conductor, meaning you don't even have to touch the line to be severely injured. Always maintain a safe distance and respect the power of industrial infrastructure. Ultimately, respecting electricity and following safety protocols are the best ways to prevent life-altering injuries. By maintaining equipment, using safety outlets, and acting quickly in emergencies, we can significantly reduce the risks associated with electrical power. Safety is a continuous commitment to education, proper maintenance, and professional installation.